Good morning, everyone. Welcome to IAD's webinar on HAP. My name is Cass Abron, and I'm an broker advisor here. As we start today's webinar, I'd like you to put your questions in the Q&A. You're all muted at this point. Our guest speaker today is Kyle Ingram from HAP, and he will be telling you more about what's going on in the west side of Michigan regarding HAP, as well as touch on the Inflation Reduction Act. Kyle, are you all ready to go?
Oh, I'm ready.
All right.
I am ready. All right, perfect. Well, thank you very much, everybody. Thanks, Cass, for putting this together. It's awesome because I see a bunch of names on here that I don't think I've gotten a chance to speak with yet. So thank you for joining us today. Excited to talk about what HAP has going on in West Michigan, and also, you know, in general, who we are as a company, what we do, and why I really do think we're a good option for you to be partnering with on the west side of the state. Give you a little bit of my background, since I know not all of you know me. My name is Kyle Ingram, lead Medicare consultant for HAP. I've been on the carrier side for a little while now, but I was an agent and broker for 10 years prior, kind of scanning everything from commercial property and casualty, small group health, and then picked up Medicare. As you can see in that progression, I always hated losing clients because I couldn't do something for them. So that kind of is why I picked up all that I did and ended up finally getting into the Medicare space, which ended up being my favorite and why I went on the carrier side for Medicare. Mm-hmm. So with that being said, I always like to start these off with kind of why HAP, why work with us as a company, why we're a good fit for your members. Number one, we're a nonprofit organization. So what that means is that we're not on Wall Street. We're not trading stocks. I don't have to worry about getting certain dividends for our investors, which honestly is a huge part of why we make decisions, how we make decisions, and focusing everything towards our members, not worrying about getting those investment returns for our investors. I can see it personally. I've been on the large national side and now being on the regional side for the carriers. Really, everything is focused in trying to make the best member experience possible and also partnering with our agents and brokers the best way we can. We are integrated with the Henry Ford Health System. No, that doesn't mean Henry Ford's our only network. In fact, we're going to talk about some changes that we've had to our network, especially on the west side of the state. Really what that means is it allows us to access those frontline providers on a regular basis, see what's going on, talk to them. Why are there repeat surgeries happening? Why are these trends starting to happen on the medical side? And then we can try to cater our plans for the next year to fit those trends and what's happening. Next, we're local. So 98% of our employees are right here in Michigan. We have offices both on the west and east side of the state. We've moved into the ASR building in Grand Rapids. So that's now a HAP ASR building since we brought them under our wings, as well as obviously our multiple HAP offices in the Metro Detroit area. As I mentioned, 98% of us live and work, play here, reinvest into our communities, both with financial investments, but also our time. A lot of us volunteer on different boards and community engagement spaces. So we like to give back to the community that we work in as much as we can. The 2% that aren't here anymore, I think it's some software guys that realize they can play on computers in warmer climate. I can't really say that I blame them. But for the most part, including our sales and customer service staff, we are all right here. The next one on here is dependability. This is normally when I like to say, hey, give me a raise of hands. How many people know what an NPS score is? But unfortunately, I can't see you all to make you do that right now. But NPS scores are something that companies use across all different industries, and it kind of tells you how referable you are by your client base, member base, whatever it may be. Give you a couple of benchmarks. Amazon, who's known for great customer service, they're somewhere in the mid-70s on a regular basis. They lead the industry when it comes to that. Insurance as a whole across the entire country, that's P&C, life, health insurance, it's a 28. So pretty big discrepancy, not a big shocker. Not everybody loves their healthcare plans or their P&C or their auto insurance, whatever it may be. Breaking that down a little bit more granular. So in Michigan, the Medicare industry, the benchmark here in Michigan is a 36. HAP is proudly a 57. So we're leading the industry in that NPS score. It means that, you know, we're removing those barriers to care. The plan, or the members are able to use the plan as they're described to them. We have the big network, so the HMO network's really not a problem in Michigan for us because we have that network built out. We have the travel benefits there. So what does that really mean? The members are happy, and I think you all know when your members are happy, that means referrals to you, right? So it's kind of twofold for us. It's us trying to invest in our members, but also invest in you as agents, trying to get you as many referrals as possible by us doing our jobs. So what's new for HAP Medicare in 2023? So the big changes, if you haven't heard, if we haven't talked about it, we are now in Spectrum Health or Corewell as they're merging in with Beaumont. So that's a huge addition for us in the Grand Rapids market. You may know us before when we were there, we just had Mercy or that Trinity network, really it was Muskegon based for us. We now have Spectrum, Mary Free Bed, Holland PHO, Answer Health, and we added in McLaren and Lansing. And this is all those providers that work for those systems are all in network. We do all-inclusive contracting. It's not pick and choose by the providers themselves. So if they're a Spectrum employed doctor, they are in network. If they're a Mary Free Bed doctor, they are in network. So that's a huge, exciting thing for us. We also launched the expansion of our HAP Senior Plus HMO products into West Michigan. Again, prior to this, we only had one plan there. It was very narrow network with Mercy. So bringing in our number one bread and butter plan to that side of the state was extremely exciting. We have a new HAP PPO plan. It's not in those counties. You're going to see our breakdown at some of the surrounding counties, but some of West Michigan has it. I'm going to tell you right now, don't sell it. It's a garbage plan that's there for comparison purposes only. It's really basically original Medicare, but with a big flex card. Our hope for that plan is when somebody calls you and say, hey, I saw Joe Namath talk about these great flex cards, you able to pair it up against another plan and say, look at what you're giving up for that big flex card. But we do have a new HMO plan that is in our full West Michigan territory that does have a $500 flex card that's partnered with MSU Healthcare in branding only. We'll talk about that a little bit more and why that's exciting for us. We added in some new counties, Allegan, Berry, Mason, Mecosta, Newaygo, and Escola counties. Dental, we increased our dental embedded benefit to $3,000 for most of our plans, and now the embedded dental includes dental extractions. OTC is earned quarterly and will roll over. That allows those to save money for some larger items if they want to. You know, you're not worried about losing that $75 a quarter. You can roll it over if you want something more expensive. Wait until the end of the year, fill your kids' stockings with it or your grandkids' stockings with Band-Aids and toothbrushes. I know my grandparents used to do that to me. So I didn't appreciate it much when I was really young, but when I got to be in my early 20s and I didn't want to buy that stuff myself, I really appreciated it. We have no limit on worldwide emergency or urgent care services. Tier 6 vaccines and selected drugs. We're going to talk about that more. Medigap, we increased our comp on that years 1 through 3 to $450 for plans D, G, and N. And then mental health copays have reduced to $0 on most plans. So that's a really big benefit, especially knowing that it was just under a third of members. I think it was 28% of members last year used some sort of mental health service. So being able to reduce that cost for them, allow them to get the mental health services they needed was a big thing that we wanted to make sure we were doing. So also why HAP? Access to the sales team. So at the end of this, you're going to have all of our contact information showing. Please take a screenshot of it. I'll get a PDF copy of this over to Cass at the end as well so that you have a copy. But myself, Jason Glutzner, and our director of sales, Dustin Van Dyne, are all very accessible to you. If you're sitting down with a member, you have a question, you need to answer it right away, I encourage you, start a group text with the three of us. One of us are probably going to have our phones in our hands at that point in time or get back to you extremely quickly. That's one of the things that the agents that know and love us, especially on the east side of the state, and a lot of the agents now starting to write us on the west side, that's one of the number one things they're telling us. On top of plan design, the fact of how fast we're able to get back to them and get them answers is a huge support factor for them.
Yeah.
We do have a dedicated email for agent support as well. That's hapmedicareagent@hap.org. That is for prospective members. We have another one for current members if you need PCP changes or anything else like that. There's been a few changes that literally just came out late last week. So I'm waiting to get this slide updated to show those. But I'll make sure I update that before I send it to you, Cass. Fast resolution for escalated issues. So this is a huge one. It was major for me when I was an agent, and I'm sure it is for a lot of you. Prior authorizations happen, right? It's part of being in a managed care plan. Some things need a prior authorization just to make sure it's medically necessary. But if those get declined, what not everybody knows is a lot of these go through an aggregator that handles basically all these PAs for different carriers. And sometimes if a certain box isn't checked by the doctor, if it's not labeled a certain way, it can get denied. If that happens, give me a buzz. We have one of the lowest prior auth rates in the state right now. I can tell you per member, we only average 0.2 prior authorizations a year because we've decreased almost 40% procedures that require those over the last few years, trying to reduce that barrier. But if something came up, I have access to our prior authorization team. We can have that pulled, have a medical doctor review it and approve it. I've had it happening as in quick as 20 minutes just last week on something. So us being able to have access to those people is a huge benefit for us, and one of the ways that we can get these things turned around for you quickly. It's not how it's been at, an old carrier for me. It was, I submit a ticket, and honestly, I hope it's worked within 2 weeks. So having this done quickly is a major thing. And then, as I mentioned, we have a large network of doctors and hospitals. It's ever expanding on the west side of the state. I know we still have some gaps down in the Kalamazoo area with not having Borges in network. It's something we're continually working on. But Grand Rapids, we have the vast majority now. Our only gap there is Metro, to be honest with you. Everything else, and that has to do with like the buyout that just occurred and some contracting things being on hold. So we're trying to work through that right now as we speak too. I already mentioned the cap or the comp on Medigap plans have been increased. One thing I will say is HAP pays the same on Medigap regardless if it's underwritten or guaranteed issue. So that's a huge benefit for you as agents as well, knowing our guaranteed issue gets paid the same way. Over 75% of our business are written through our external brokers. Honestly, I just looked at the numbers the other day. It was actually 84% of our business were written by local boots on the street agents like yourself. Thank you so much for everything you do. You are such a huge asset to our members, making sure they're being taken care of, understanding the plans they're on. So I honestly can't thank you enough for what you do every single day. And then also, we do have an orphan program. If you're not aware of it, it's every 10 new to HAP applications in a quarter, you can earn one orphan account. So that's an account that's been with HAP for over a year with no agent of record assigned to it. We'll assign you as agent of record on that account, and you'll start collecting commissions on those right away. It's a huge benefit, honestly, for both of us. You're building your book of business by partnering with HAP, but also we know retention's a little bit better when there's a broker of record on it and somebody's reaching out and be there to answer questions. So we're excited to partner with you all on that as well. If you have any questions about that specifically, let's get together. We'll talk about it at another time. So why we all are kind of here, what sets our plans apart? The left-hand side of the screen is our HMO network. Our PPO is on the right-hand side. As you can see, we have a few gaps on the west side for the PPO. I've been promised that this is going to fill in 2024 for us. So keep in mind, our PPO is coming out that way. We're super excited. We're working on enhancing it right now. So we're very, very excited for what's to come. But our HMO plans, which are currently there, is what I'm going to spend most of the time on in terms of plan design. So quick overview, most of our plans have a $20 PTOT and ST copay, $0 mental health. We include our senior savers model, which I'm going to talk about more. Our emergency room and urgent care copays are all inclusive. So it's not a facility fee, it's not copay stacking. It is just, you go into the ER, it's a $90 copay. You go to urgent care, it's a $55 copay. That's what it is. You're not going to get hit with any surprise billing on those. On the HMOs, we have in-network cost share when you're in Florida, Texas, and Arizona. Any Medicare provider willing to bill HAP, in-network cost share. The other part that isn't on here that I do want to mention, because somebody just emailed me about it earlier today. If a member is going outside of our service area, so actually I'm going to go back a couple slides here. You see that orange area. Well, when you get north, where a lot of people in Michigan like to go in the summertime, right? We have two types of people that go south in the winter or they go north in the summer. So if they're going up to Sheboygan, Traverse City, they're going to the UP where it's currently out of our service area, they actually can access that same travel benefit on our HMO plan and see any Medicare provider for an in-network cost share. That's something that a lot of times get missed, but and sometimes people sell them a PPO plan because, you know, there's no doctors up there. You're actually in a better situation being on our HMO plan because you're going to have that in-network cost share, not an out-of-network to worry about. We $0 copay for labs, tier 1 and tier 2, 90-day mail order for $0 through Pharmacy Advantage. Delta Dental is our dental network. They're Premier and PPO for the embedded. And like I mentioned, $3,000 is the limit for that. So outside of those things that I highlighted on, I just wanted to do a little bit of a dive into these plans. So the HAP Senior Plus was our #1 plan the last 4 years, I believe it is. It has our highest enrollment. Big thing about it, obviously, no referrals are required, even though it's an HMO. You just have to assign the PCP. We don't require referrals for the specialist. It has a $4,500 max out of pocket, $310 days 1 through 6 inpatient, $250 for an outpatient copay, and then $155 if you get that done at an ASC center. So if they need cataract surgery, or you know, they're starting to actually do a lot of replacements, knee replacement, hip replacements at these ASC centers, they can save a ton of money by going there and getting it for almost half the cost share at $155. PCP is $0, specialist $40, but then you can see PT, OT, and ST is $20 copay. And the reason I'd like to hone in on that is thinking about our members here in Michigan. We know that somewhere around, I don't know where the statistic lies exactly for 2023 right now, but it's at least somewhere hovering in that 40 to 50% of our members in Michigan are just on Social Security. They don't have a pension, they don't have a 401k, they don't have additional income coming in. So when you're talking, if they have a stroke and they have to go to PT, OT, and ST, each of those 3 times a week, those copays add up. And then they stop going because they can't afford it anymore. Because now it's, do I go to PT or do I buy something for dinner tonight? So we wanted to reduce that as much as we could, got it down to $20 on this, which is almost half of most of our competitors in the market. The other thing is I mentioned the OTC does roll over at $75 a quarter on this plan. So that's a great benefit as well. And most of those supplemental benefits I've already reviewed or will dive in deeper in a little bit. So the one I'm really excited to talk about is the MSU healthcare plan. As I mentioned, that is in branding only with MSU. It's not a limited network. It's our full HMO network, our full HMO service area. It's just a green and white ID card with a little Spartan helmet on it, and same thing with the Flex card. It's green and white with that logo on there as well. The really nice thing about that is we listened to our members and the market in general. They wanted some sort of flexibility within their plan. You know, they've been paying into this system for so long. They've been listening to Joe Namath and JJ Walker talk about, you know, all these flex benefits that they deserve. So we wanted to put something in there for them that's a little bit different than our Senior Plus, even though the plan looks extremely similar. That flex card, though, is $500. $200 a year can be used towards dental, vision, or hearing. So they already have $130 embedded vision benefit, but if they want a really nice pair of frames, if they want the upgraded lenses, you know, with whether it be the blue screen lens or they want scratch proof or anything else in there, they can use that $200 on the Flex card to pay for that additional coverage. And that's just like a prepaid MasterCard. $300 a year on that can be used towards OTC, transportation, peers, or companion care. So they want to be able to go to CVS or to Meijer to buy their OTC items. They can use the card for that there. We are dealing with a more tech-savvy T65 group. So as people are aging in, they're using Uber and Lyft. They can actually load that car into their Uber and Lyft app and pay for rides that way if they wanted to. So it's something that we wanted to bring in. It's brought in a ton of flexibility. And honestly, on the West Side, where plans are so close on all the copays, that's been a big differentiator for us. In the Grand Rapids area alone, I know this plan is overperforming the Senior Plus just because of that flex benefit, which is huge. On the actual plan design side, $5,000 max out of pocket, slightly higher copays for the outpatient. So you have $270 at the hospital or $185 at an ASC, but then our specialist copay drops down to $30. So that's a really nice benefit as well. And we're still market leading at $30 on the PTOT and ST on this plan. So extremely strong benefits, but bringing in that flexibility of a flex card really allows them to have something a little bit different than they're used to, go to Meijer, go to whatever store it is they need to, and use that for their OTC benefits. As long as it's a major pharmacy or grocery store, they are good to use it there. Next one down is our HMO MA only. So as most people know, these are usually driven towards veterans just because they're getting their prescription drugs through the VA, CHAMP VA, TRICARE, whatever it's going to be that's paying for them. But there are a couple other people that I want to let you know fall into this class, and I feel like we're going to see some more of these as we go on in time. One of these are the members, and I know you've all seen them before. They were sold a MedSup years ago, and their agent said, I don't do the prescription drug card, just go to Medicare and buy that yourself. And they never bought it, right? Because they weren't on prescription drugs at the time. They weren't aware of a Part D penalty. And now they're just sitting out there with a MedSup and no Part D coverage. As they're coming off that MedSup because it's becoming too expensive, they don't want a $40, $50, $60 Part D penalty to hit them. So they stay on an MA only. They're good with using GoodRx or something else if they have prescriptions, but they get that $50 a month in the Part B rebate back that they really like. The other ones are our holistic members. So the ones that go to see doctors that are not covered by Medicare. They keep Medicare Parts A and B just as, catastrophic coverage for them, essentially. If something happens, I have a stroke, I need to go to the hospital, they keep that. They're not going to take prescription drugs unless, honestly, it's a life-saving drug at that point. So this is another fit for them. So your holistic members, those with a MedSup and no Part D, and then obviously the veterans, this is a phenomenal plan. If you are working with the VA community, I would be talking about this plan specifically a ton, mostly because of what we did with some of the cost shares that are on here. When you normally talk about a VA plan, people are like, well, that's great. What? You give them a rebate because there's no Part D and they don't actually use it. They go to the VA for everything. Well, true and not true. There's actually a few services that veterans seek on a regular basis outside of the VA system. And talking to a friend of mine that actually works for the system back where I'm from, he said the two major things he sees people going outside of the VA system for are PTOT and ST. That's because sometimes the VA is just not convenient to get to. So if you've got to go to PT a few times a week, you want to go to a local specialist that, and quality of care, honestly, they want to go to somebody that's able to take care of them a little bit better. So this is a $10 PTOT and ST copay. So it keeps it extremely affordable for these members. The other thing is mental health services. You just heard me kind of talk about stigmas going away in these. A lot of people are starting to use mental health. Well, guess where the stigma is not going away from mental health? And that's within the veteran community. They don't want the brothers and sisters they served with to see them going into that wing of the VA because everybody knows what that hallway is for. So they go to seek those services a little bit closer to home and a little bit more private where they're not seeing them go in there. That is a $0 copay on this plan. So again, trying to take care of our veterans, making sure that they have these great benefits. And then all of these plans, which I haven't touched on yet, have our fitness membership included into it. So that's with PureFit Move. We are ever expanding the network on the west side of the state with them. But the really nice thing is PureFit has arranged for a 6-month out-of-network reimbursement for our members. So they can at least get reimbursed up to $80 a month for half the year for using that out-of-network gym. So it's a huge benefit. And honestly, for us, it's a big help when somebody's doing that because it shows to the gyms you could be having a member or even more members coming to your gym if you would just join this network. So it works kind of as a double-edged sword for us to try to get those gyms in, but also the members being able to utilize the benefit that they may not have been able to before. So PPO plans, again, like I said, they're not in every county over there. There's actually just a few if you're considering West Michigan as a whole. So I'm just going to talk real briefly on this. All of our PPO plans have a national in-network cost share with doctors who accept Medicare in all 49 states outside of Michigan. So that's what changes a little bit, the travel benefit. Inside of Michigan, out-of-network cost share applies if they're not within our network or if they're out of our service area, that out-of-network cost share still applies. But the second they leave Michigan in the U.S., they have in-network cost share at any Medicare provider. They don't have to worry about following some different network out of state or something else, any Medicare provider. Still has that $310 inpatient copay days 1 through 6, $20 PTO/TST copays, $0 mental health copays, $50 a quarter in OTC benefits that roll over, and still the same great prescription and dental coverage as well. So super strong. I think they're going to get even stronger going into next year. At least I'm praying and asking for it, just because I want us to come out to the west side with an extremely competitive PPO product for everybody. So dental, you've heard me talk about our embedded dental. We utilize Delta Dental's Premier and PPO network for the dental services. It includes 2 exams, so that can either be 2 prophylaxis, so that's the over-the-gum cleaning, or 2 periodontal maintenance cleanings. So that replaces those prophylaxis, but if you're having somebody that gets this periodontal maintenance, they usually go anywhere from 2 to 4 times a year. No plan really covers more than 2 of those services on that side, so it's a big benefit to at least have those, because some of them out there only cover the prophylaxis, and they consider the other ones comprehensive. Brush biopsies covered at 100%, 2 fluoride treatments a year. And I get asked all the time, Kyle, why are you providing seniors with fluoride? Isn't that something we give our kids? Honestly, fluoride is such an important thing for our seniors. It helps strengthen the teeth, what reduces cavities. It reduces a whole bunch of other things that could happen. And honestly, an untreated cavity with a senior can cause hypertension or other whole body issues. So we want to make sure that we're trying to make those teeth as strong as humanly possible. Also, the x-rays once every 5 years for the panoramic x-ray, so they get their bite wings every year. And then you go into the comprehensive side. So fillings, doesn't matter what type of filling, it's 50% copay. Root canals are 50%. Crown repair, bridge realigns and repairs are covered at 100%. And then simple extractions are 50% for a max $3,000 benefit. We do also have our buy-up options available for our members. So what's really cool about our buy-up options is if you're getting a service that's covered under the embedded, the buy-up option actually works with that embedded benefit. So it coordinates. Consider it 2 wallets paying for a procedure. So if you go for a root canal and say, I'm going to make math easy because math is hard, say it's $500 for that root canal, the first 50% is picked up by the embedded. The second 50% is picked up by the buy-up option. So the member actually just got that $500 procedure for $0 out of pocket. Wow. It does also bring in some additional major comprehensive services. Now, these are only covered under the buy-up side. So if you get the Delta 50, you have up to $1,000 for these services. I get asked all the time too, if getting the buy-up brings that $3,000 balance over to these new services covered. It does not. That is just for what's covered under the embedded. But this is what brings in, dentures, implants, new crowns, and a few other periodontics, not just the perio maintenance. So you can get all of those. The Delta 50 and Delta 70 utilize our Premier and PPO networks. The Delta 100, which is the richest benefit, is only the PPO network, which right now the PPO network is a little bit limited. I will admit that, but it is an ever-growing one. The Premier network is no longer available to those dentists that graduate dental school after 2014. So pretty much all these new dentists we get coming out of dental school, if they're joining a dental network, and they're probably joining Delta, it's going to be at that PPO level. So that's going to be an ever-growing base as well. Prescription drug coverage. So this is the one thing, as we dive into this, you're going to see, but prescription drugs is where we definitely win against all of our competitors on the west side of the state. There's been some studies done. We're working on the licensing side of that, so I can't quote them right now. But we were the lowest cost share in all of our counties when it comes to prescription drugs against our competitors because of a few things that we've done. But the first thing I'll touch on this is the Inflation Reduction Act, because it has impacts on everything, right? So the Inflation Reduction Act that was passed last summer caps in formulary insulins at $35 through all phases of the coverage, initial coverage gap and catastrophic. The most you can pay is $35 for those insulins that are in formulary. So that is for starting 1/1 of this year. That was all of your Part D insulins. Part B insulins, which are insulins for pumps, that $35 cap starts on July 1st. So it hasn't been in place, but the good news, if you have members on those pumps with the insulin, whether it be the Dexcom or something else, huge advantage for them coming July 1st, that's going to be capped at $35. The one thing also I want to mention, it does not impact our senior savers model or drugs that are considered non-insulin. So that's your Trulicity, Jardiance, and Ozempic. Those are not insulin, so they are not covered by the Inflation Reduction Act. A few other things that are going to happen with this IRA. The catastrophic copay of 5% is going to go away in 2024. Now, there's a few things I want you to think about when we're talking about the next couple of items. So that 5% is going away in 2024. The plan's going to absorb that 5%. So right now, Medicare is covering 80%, the plan is covering 15%, and the member covers 5% in the catastrophic phase. In 2024, it's going to become 80-20, 80 Medicare, 20 the MA plan or the PDP. In 2025, they're going to introduce a $2,000 max out of pocket for prescription drugs. That's going to have major implications, especially in the PDP market. My personal opinion is when you take a look at the breakdown of how those drugs have to be paid for after that $2,000, 60% with no cap for the plan is paid for by the Medicare plan. So whether it's the PDP or the MAPD, 60% until the end of the plan year is being covered by the plan, 20% by Medicare, and then a 20% by the manufacturer. So where it used to be, we had all these little stops and, the plan wasn't paying a huge amount. I mean, it eliminates catastrophic phase, and 60% in perpetuity until the end of the year is being covered by the healthcare plan. So what's going to happen on the PDP side? The other rule that's in there that I don't have added in is that year over year through 2029, PDP plans cannot increase their premium by more than 5% year over year. So they're not able to make it up by pricing. So what's going to happen? Again, personal opinion, not HAP, just looking at the market and seeing how companies have done this in the past, I think you're going to see it in formulary reduction, probably going to get a lot more bare bones formularies. You're probably going to see a lot of plan elimination and then introduction of new plans that are going to be higher cost share. So that's going to cause some abrasion with your members, right? Because you're either going to get crosswalked or you have to rewrite them, or you're going to see more and more companies going with, not working with external brokers, only being direct. And the last thing is them trying to make up the cost share. If they have a Medicare supplement plan, so a plan G or something else, you may see a spike in those premiums as well. It's on the MAPD side, I don't see it having as big of an impact because we have the medical management side of things, right? So the whole point of us, and I did a whole presentation at another time, and I'm happy to sit down and do it with you each individually. Medicare Advantage plans have better health outcomes for the members, which allows them actually hopefully to get off of a lot of these drugs and have less of a need to be on them just by taking care of them on the medical management side. So I don't think the MA plans will have as big of an impact. There may be some other factors that come into play for a few of them, and we'll see what happens. I won't speculate on that. But overall, there's going to be a lot of shakeup in the next couple of years. The good news is I think a lot of it's going to be good for members. 2026 and beyond. So starting this year, actually in September, Medicare is going to announce the 15 Part D drugs that they're going to start negotiating pricing for. Those negotiations will be done, and they'll announce what the prices are going to be in August of 2024 or September of 2024, but it won't take effect until 2026. So they're giving the manufacturers time to basically build in the cost share of everything that's going to be there. And they're going to continue to do this pretty much every year moving forward, is negotiate the prices on these drugs. Thing is, though, don't get too overly excited. They put a lot of stipulations around what drugs they're going to negotiate the pricings for. And it's basically any drug that does not have a generic version or a biosimilar. So if you're on Ozempic, they're not going to do that because you got Trulicity or something else that's going to be considered a biosimilar that does the same thing. It's really truly for those drugs that there's no competition. There has been no regulation on trying to keep the cost down on those because they basically have a monopoly on that one therapeutic class. So that's what the government's going to be going after to negotiate the pricing on. So I mentioned that the IRA had no effect on the senior savers model. That's a completely separate program that plans have to opt into and select which insulins are going to be in that plan. It looks the same way though, right? It's capped at $35, but it actually allows us through the senior savers model to list what price we actually want our drugs to be. They just can't be higher than that $35 for the insulin. So what we do is we have 4 insulins in our senior savers model. That's Novolin, Novolog, Lantus, and Toujeo. And for our plan, our members through the initial and the coverage gap phase can do 90-day mail order for $0 cost share through Pharmacy Advantage. So even those members that are on insulins that are capped at $35 a month, if the plans don't have a senior saver model, or they don't have their insulin and formulary and they don't want to have to switch it around. I mean, we're saving them a ton of money quarter over quarter by able to do that 90-day mail order for $0 cost share. At the pharmacy, if they want to do a 30-day supply, they don't like mail order, they want to go pick it up 1 month at a time, it's $10 at a preferred pharmacy for that insulin. So again, covering it much cheaper than what the Senior Savers model says we have to be at, and lower than the Inflation Reduction Act.
Hmm.
So I mentioned that. We also moved metformin, both types of metformin, to tier 6. So that tier 6 allows for $0 cost share through the coverage gap as well for these common generic drugs. We have $0 cost share for CGM, so either the Dexcom 6 or the Freestyle Libre. If you were watching the Super Bowl, you would see that Dexcom did a major ad for the Dexcom 7. We're already looking to see if we can add that in mid-year, make sure that it's covered. So we're on the works for that. Be on the lookout for information. And then $0 for diabetic self-management supplies. So that's the Lancets, an administration device, blood glucose monitor, and a pair of therapeutic custom molded shoes for those diabetic members. Tier 6, as I mentioned, is a tier that allows for $0 cost share through the coverage gap for certain things. The major part is we have vaccines in there as well, so they can go to the pharmacy and get the shingles vaccine for $0. Hepatitis A and B, measles, mumps, rubella, and meningitis. Go to the pharmacy, $0 cost share. And then also, there's a whole list of other medications that we've used to tier 6. Again, I will get a PDF copy of this over to Cass today. Let you in on a little bit of secret from me. I can't pronounce prescription drugs very well. I will admit to it. Not my strong suit, so I'm not going to go through and try to read through all these. I can let you know that most of the statins are in there, so that's what a lot of members are on, $0 cost share through the coverage gap. I know people say big deal, it's a tier 1 with most companies anyways, but when you get to the coverage gap, now a cost will apply for those drugs, so we can actually get them to continue paying $0 for that.
Well, that's great.
We also moved a bunch of drugs that were in tier 3 or tier 4 down to tier 2. The reason we did this is we wanted to make sure that our members were able to get these drugs until they got to the coverage gap, understanding that's still going to apply. We're trying to get them to that point for the least out-of-pocket amount as possible. So the few prescriptions I can say, because they're on TV all the time and I get them hammered in my head, I call them the TV drugs: Trulicity, Jardiance, Victoza, Ozempic, all of them are tier 2. So until you get to the coverage gap, that's 90-day mail order for $0 cost share on these drugs. It is a huge saving for our members. When you pair them that they could also be on an insulin or something else, having that cost savings is major for them. It can save members for a couple of the quotes that I've done against competitors. Closest regional carrier and price for a few of those were like $300, $350 a year savings with us, and the closest national was actually almost $700 on that. So it's a huge savings for our members to be able to do that. And then what does HAP do to help? Number one, we send term emails, and it's not at the end of the month, unless the member terms at the end of the month. Once a week, we send a term email. If your member has gone to another plan, we let you know, hopefully so you still have that consent to contact or are able to reach out and see if you can save them. We see a huge amount of agents able to save the plans that they didn't actually move the member, because a lot of these call centers, they're calling, they're getting a hold of people, they're, fraudulently enrolling them, honestly, or making them think, they're able to keep both plans. So we were actually able to save a ton of them. What I don't have on here is during AEP, obviously when you get a ton of enrollments and disenrollments, we reach out to those members that we know are going to the carriers the large call centers are writing. And we're talking to them basically at the disenrollment phone call, just to let them know, hey, whatever you did disenroll from your HAP plan. Just wanted to make sure you were aware. We're sorry to see you go. And we actually saved over 200 members during AEP just by those disenrollment phone calls. So we're saving them for you. You don't have to worry about it coming off the books. We're kind of just stopping those call centers. If they say, hey, yeah, I sat down with my broker, John Smith, and they're our partner, we walk away from it. We don't say anything about trying to save it because we know you guys are doing the right thing for your members. It's more of the call centers we're trying to stop from doing what they're doing. We also do proactive outreach to our members. So if they're not utilizing their dental benefit or their OTC, and we notice that 6 months into the policy, we're going to give them a call and say, hey, did you know you have this benefit? Do you know how to use it? Can we help you place your first OTC order? Can we help you find a dentist that takes the plan if you haven't used that benefit? We want the members using all the benefits we're giving them. Again, we don't need to show the profit to give investors at the end of the year. We're a nonprofit. We want to make sure they are using every single thing we're giving them, because we know at the end of the day, that's going to make them healthier and happier. And then we do also send monthly birthday notices to all of our agents of their members that have birthdays coming up that month. So it's just an extra little thing we like to do. Not all agents utilize it, but those ones that don't like to put members' birthdays into their in their CRM, or maybe they forgot for somebody and they like to send out birthday cards, it's just something extra that we do. And then the last page I have here is our contact information. As I mentioned, myself and Jason Glucksner are the lead Medicare consultants. Dustin Van Dyne is our director of sales. And then we have our general questions inbox there. I wasn't just saying it earlier, please start a group text with the three of us. We are more than happy to answer any question you have, especially if you're sitting down with a member. We know you need that answer right away when you're talking to them if you have a question, so we'll take care of it. I know we have our contracting person here. If you're not contracted with HAP, talk to Cass. She'll be able to help facilitate that for you. And then our commissions person is Punita Sharma as well. I'm going to open it up to anybody that may have questions on here. Please feel free, as Cass said, put them in the chat box. I'm happy to answer anything you may have. And if not, thank you very much for joining us today. Really appreciate your time. If we haven't had a chance to meet yet and you want to sit down, kind of talk about things more in depth, I'm on the west side of the state at least once a week. Please shoot me a message. I would love to set up coffee, lunch with you, meet at your office, whatever it may be, and just kind of answer any questions you have. But again, we'll open it up for questions, or if you're dropping off, I hope you have a great day.
Doesn't look like we have any questions. No questions so far.
Oh, guys, don't make it this easy on me. Make me work for it.
No, you just answered everything. You were so thorough.
That or I put them all asleep. One of the two.
Well, as Kyle said, oh, we have a question. Any plans to expand to Traverse City?
Obviously, we don't have any expansions for 2024 that I'm aware of going there. I know our goal is over the next few years to at least have the whole Lower Peninsula. So I will say yes, but I can't tell you when because I don't know yet either, but it is on our focus list.
Well, Kyle, Warren says you did a great job.
Thanks, Warren.
Any other questions? Come on, you guys. Don't let them off that easy.
You can ask my favorite color. I don't care.
You seem to have covered everything, Kyle. I do want to tell you that we'll be, IAD will be having a summit at the end of the month on March 30th in Troy. And if you haven't looked at your email lately, check it so that you can register for that. It's going to be a lot of information on all the different carriers. So we'll be happy to see you there live.
I hear there's a great carrier panel that's going to be that day.
Oh, yes. It's going to be a great carrier panel.
I'm excited.
Well, if there aren't any more questions or comments, I want to thank you again for coming and joining us today, and we'll see you next time.
Thanks, everyone. Thank you, Cass.
All right. See ya.